Guys, and welcome back to my YouTube channel. And today we are going to study a very interesting and a new subject, which is pathology or pathomorphology. It has two parts, morphology and physiology. In morphology we'll deal with the anatomical aspects of various organs, and physiology will study about the mechanism. So for today's chapter we will study about cell injury. So cell injury are divided into two types, which is a reversible injury and a irreversible injury. A reversible injury can be reversed, as the name suggests, and the irreversible injury can be fatal, right? It is very difficult for it to come back to its normal state. So before starting the topic, I would like to discuss about two terminologies over here, which is etiology and pathogenesis. So what exactly is the etiology and what exactly is the pathogenesis? So etiology is basically the cause of a disease, and pathogenesis is the progression of the disease. So etiology can be various factors, right, which can influence the cause of a disease, and pathogenesis is the further progression. So please remember this will be very useful terms. So let's start with the reversible injury. So what is a reversible injury? Suppose when we place a cell under a stress situation, suppose somebody goes for a trekking or something, right, and they go to a certain height, what happens is the level of oxygen is less over there. So what will happen? The cell will try to adapt. Our RBCs will try to adapt. They'll start producing more number of RBCs. Their binding capacity with oxygen will increase. That is an adaptation, right? So the cell tries to adapt, and when the stress situation is removed, like when you come down again, your cell goes to your body goes to normal homeostasis. Homeostasis is achieved, and no much changes take place. But over here, yeah, the cell becomes normal when the stress situation. That is a reversible injury. What is an irreversible injury? Suppose you went to the mountains, your body couldn't adapt to it, and then you have altitude fever, right? Altitude sickness. So what has happened is the compensatory mechanisms over here are over, like whatever the body did, so that your breathing rate has increased, the number of RBCs is increased, more production of RBCs, and more binding capacity with oxygen. Everything is done. This is compensatory mechanism. Now after this, still if there is no desirable changes, homeostasis is not attained, then what happens is the cell tends to move towards an injury, right? Injury takes place in the cell. Maybe the cytoplasm, cell membrane might burst, or anything can happen. Oxidative changes can happen. So that is an irreversible injury. So this is how a table classification is seen. So what happens over here is it can be etiology can be inherited or acquired, or in case of immunity absence, like immunocompromised patients, those patients who are using immunosuppressants like cyclosporins, infections and toxins, natural imbalance, and trauma, right? So these are all the etiology. This is all the cause of a disease. Next is pathogenesis. What will happen is a biochemical change or a structural change will take place in the cell. A biochemical change or a structural change. If mitochondria is damaged, then your various cycles are affected, like the Krebs cycle won't take place, oxidative phosphorylation won't take place. Similarly, the structure changes, like suppose the structure of the carrier protein is changing, or enzyme is changing, like at the allosteric side or the active site, then again there is a structural change in the cell, right? So it cannot bind to its substrate. So what will happen here is this leads to molecular, functional, and morphological change in a cell or a tissue, right? This causes certain changes in the tissue and in the body. So what can we do here? We can see certain clinical manifestations. That is, we can clinically see that there is some change in the cell happening, due to which there is a issue or there is a problem going on with the cell. So this is how we define how the cycle of etiology and pathogenesis go. Then let's go to cell death. So cell death is a very crucial event in evolution of diseases in tissue, resulting from ischemia, toxin, immune reaction, cell immune reactions. Cell death is normal and essential process in embryogenesis and for maintaining homeostasis. So cell death can be pathological, can be physiological, right? Physiological, I mean, is through normal ways our body eliminates the old cells and new cells are formed, like the epithelium cells on the cheek or the dermis layer of the skin, right? So those layers continuously keep changing, so they are normal cell death, right? So that new viable cells can be replaced. New viable cells take over the old and dead cells. So that is normal, that is physiological. But pathological is when there is, due to some disease or some trauma, where it leads to necrosis. So those are the types of pathological diseases. So this is a schematic representation how it happens. There is a normal cell. In injury stimuli, what happens? A reversible injury is taking place initially. If there is severe progression of the injury stimuli, it goes to an irreversible injury, which is divided into necrosis and apoptosis. These are the two types of skull death. We will discuss into detail what is necrosis, the types of necrosis, and what is apoptosis, how apoptosis takes place. So next is the cause of injury. It can be hypoxia and ischemia. Ischemia is basically congestion of the arteries. The arteries are getting congested so that there is decreased blood supply. So most common reason of hypoxia is ischemia. So due to ischemia there is hypoxia. Next is toxins. So let us say for toxins, suppose there is Shigella. It produces endotoxins and exotoxins. So Shigella like toxins are produced which can cause diseases. It is a bacteria. Next is infections like viral infection, bacterial infection, fungal infection, immune reaction. So this can be due to autoimmune disorders, right? This can be autoimmune, genetic abnormalities like Down syndrome, Turner syndrome, wherein the immunity of the patient is decreased. Next is nutrition imbalance, like in diseases such as Kwashiorkor, Marmor syndrome, where there is protein and calorie deficit. There can be issues with leading to cell injury, right? Next is physical agents such as trauma. There can be chemical agents also over here such as UV rays, carcinogens, and various other things. And finally is aging. Aging is like normal, how the cell grows old and it dies. So next let's come to reversible injury. So the two main morphological features of reversible injuries are, one is swelling, right? One is swelling. It is also called as hydropic changes and vascular degeneration. There is hydropic change and vascular degeneration. This is seen due to increased permeability of plasma membrane. When it affects many organs, it is called as pallor. So what happens is compression of capillaries takes place, the turgor pressure is increasing, right? Turgor pressure is increasing and the weight of the organ overall increases. So this is basically swelling, right? There is more water moving to the cell. Generally the plasma membrane is selectively permeable, right? To limited amount of substance. But here the permeability is changed and more of extra tissue fluid moves to the interstitium, right? So the weight of the organ is increasing. Next is fatty changes. So manifested by appearance of triglyceride containing vacuoles in cytoplasm and is seen in organs which are generally involved with lipid metabolism. I could say smooth endoplasmic reticulum is involved, liver, so we can see fatty changes of the liver, right? Fatty liver disorders are there. Then these are the changes which in case of alcoholic liver diseases also, where the chemical is causing the fatty changes of the liver. So these are the various things which can be seen in the liver. Next is like examples here, smooth endoplasmic reticulum shows hypertrophy when exposed to chemicals in an adaptive response. Like I told you, alcohol, right? Alcohol causes this. So these are two different terms, hypertrophy and hyperplasia. Hypertrophy is when just the weight of the cells is increasing or the mass of the cells are increasing, right? And hyperplasia is when the number and mass, both of them are increasing. So hypertrophy is there is no division over here, only the overall weight or the mass of the cell or tissue is increasing, whereas in hyperplasia what happens is the overall, the number of cells as well as the number of and the mass of the cell both increases. So these are the two main morphological features of reversible injury. So we can say that reversible injury leads to swelling and fatty changes. Now we will discuss what an irreversible injury causes, what are the changes it is causing. Then we will move towards the type of necrosis like caseous necrosis, gangrene, and various other things. Just now we discussed about the features of a reversible injury, right? Now we'll discuss the features of an irreversible injury, how it looks like. So what happens is inability to restore mitochondrial function. As I told you, mitochondrial function such as oxidative phosphorylation or Krebs cycle or various other mechanisms that cannot be restored. Loss of structure and function of plasma membrane. The plasma membrane structure is gone, the integrity is gone because of the microfibrils, the actin filaments, integral fibrils, whichever hold up the plasma membrane, the structural proteins are lost. And hence the plasma membrane is not intact anymore, and loss of DNA and chromatin integrity. So as we all know that the coiling and supercoiling takes place around the histone protein, right? The histone protein holds up our chromatin. So their condensed structures they're around it and they present in the nucleus. So what will happen once the nucleus is destroyed, the DNA and the chromatin also lose their integrity and they are just present in the cell and they will be digested later on. So this is the characteristic of an irreversible injury, how the irreversible injury looks like. Next we will go to necrosis. What is necrosis? So accidental cell death, right? Accidental cell death is necrosis. And this is the most common pathway of cell death. Like majority of the cell in the body die due to necrosis itself. So necrosis always triggers an inflammatory response and it is always pathological. Necrosis is always pathological. It is not physiological. Necrosis is always pathological. Do remember that, right? Next is apoptosis. Apoptosis is a programmed cell death. When an injury is less severe or certain cells of the body have to be eliminated, so the method used by the body is apoptosis, right? Next, the term is necroptosis, which is necrosis and apoptosis, the combination of both. So when we study in detail about necrosis, how the cell membrane changes, we will discuss about that over here. So what happens is, first is the cytoplasmic changes. So the cells show high eosinophilia. So eosinophilia is basically they'll stain in dark pink color. Dark pink color is the staining of eosinophilia. So the cells show high amount of eosinophilia. Next is nuclear changes. So there are three patterns, all result into the breakdown of the DNA and chromatin. So what is it? Pycnosis. So the nuclear shrinkage will happen. Increased basophilia. So here there will be dark stain color, that is purple color. The nucleus will stain in purple color over here. Condensation of DNA into dark shrunken masses. So the DNA will condense completely. Next process which takes place is karyolysis, or nothing but simply it's the bursting of nucleus and then followed by karyolysis, which is complete dissolution of the nucleus. So karyolysis is bursting and karyolysis is complete dissolution and breakdown of the nucleus. So this is simple outlook of how necrosis looks like. So now we will discuss about the types of necrosis. So we have coagulative, liquefactive, gangrene, caseous and fibroid necrosis and also fat necrosis. So we'll discuss about coagulative necrosis. What happens over here is, so the underlying tissue architecture is preserved for several days after death. So if a cell is died due to coagulative necrosis, so we can identify which tissue that was or which organ that was, right? Because the tissue architecture is preserved. Injury denature. Why is it preserved? I'll tell you now. So the injury, right? So I was explaining why the tissue architecture is preserved. So what happens over here is, due to the injury, what happens is denaturing of the structural protein and the enzymes takes place. So if the structural protein and the enzyme is denatured, so there is nothing to hydrolyze it. As you know, the hydrolytic enzymes are present in the cell, within the cell. So what happens is, the lysosomes carry it. They're also called as suicidal bags. You can remember it in that way. So what happens over here is, they are denatured, right? So they are completely denatured. The structural protein of them, or the protein which is responsible, enzymes are what? In simple words, they are proteins, right? So they are destroyed. So due to which proteolysis doesn't take place, that is why the architecture of tissue is preserved. We can figure out what tissue it is. So again, eosinophilia is seen. Anucleated cell. The nucleus is destroyed over here. That is, karyolysis and karyolysis is taking place. And cell is preserved for many days, right? For many days after the necrosis has taken place. Leukocytes clear the debris. And phagocytosis takes place. So phagocytes are involved over here. That is neutrophils and macrophages. And this can happen in all solid organs, like liver, parenchyma, the lungs, except brain. So all organs except brain, coagulative necrosis can take place, right? Coagulative necrosis can take place. Next is liquefactive necrosis. So what happens over here is, as the name suggests, it becomes into a liquid. And what is the most common pathological liquid found in our body? It is pus, right? Pus, or an abscess, you can say it. So that is the most common seen. So what happens? This is seen in case of bacterial infection. What kind of bacteria? Staphylococcus aureus, Streptococcus pyogenes, or Escherichia coli. So these are the bacteria which can form pus in the organ, right? So these are seen in such cases of bacterial infection. They stimulate inflammatory cells and enzyme digests the tissue. So inflammation will take place. The mast cells are involved, histamines, immunoglobulin E. What happens is, it leads to the bursting of the cell, due to which the proteolytic or the hydrolytic enzymes are released from the cell, and this causes due to complete digestion of the cell. So once if it is digested, what happens here is, the architecture of the tissue is not preserved, right? We cannot find out which tissue it was once this has happened. So the most common example over here is the hypoxic, the injury caused in the central nervous system or the brain due to hypoxia. Mostly it's seen in case of in the dura mater it is seen more. So when there is an hypoxic injury in the CNS, right? So due to which the pus is formed, liquefactive necrosis takes place and the tissue is destroyed. We cannot identify what tissue it was. Next is gangrene. So gangrene, as you all might have seen in pictures, like completely black limbs. So this is due to cut of complete blood supply over there, right? The blood supply is completely lost. That is why the cells start to die. And it happens in organs which are always in contact with the environment, such as the appendages, upper limbs, lower limbs, the foot, right? And yes, there are two types of gangrene. One is a dry gangrene and one is a wet gangrene. So wet gangrene is what? When a bacteria infects it. Again, which type of bacteria? The pus forming bacteria, like Staphylococcus aureus, Streptococcus pyogenes, E. coli. When they infect the dry gangrene turns from dry to wet. So here the character will be again, yes, smelly substance. Pus will be released, and also along with that you can see a reddish color over here, whereas in case of dry gangrene it is completely dark black in color. So this is all about gangrene, right? And yes, another thing, we can see this in case of diabetic foot also. In diabetic foot also we can see the same case, where you have gangrene, it is a wet gangrene, and most commonly it is affected by bacteria, so it turns into a wet gangrene, right? In case of diabetic foot is a classical example for a wet gangrene. We can see wet gangrene over there. Next is caseous necrosis. It is also called as cheese-like necrosis, and it is a combination of coagulative and liquefactive, right? There is both coagulative and liquefactive. So to some extent the tissue is preserved and to some extent the tissue is lost. So we can identify what type of tissue was present over there. So it happens in the foci of tuberculosis. So when tuberculosis is happening, right, we see certain foci or nodes like thing formation, right? So their necrosis takes place, which is surrounded by macrophages, right? And we have few giant cells also over there and certain epithelium cells through which we can clearly identify that these nodes present in the lungs are of tuberculosis itself and not in case of lung cancer, wherein we can see clubbing. Clubbing is seen in case of lung cancer, but then we see nodules formation in case of tuberculosis, right? And also in the nearby lymph nodes also we can see the same thing. So this is characteristic of nodular inflammation lesion. It is cheese-like and it is liquefactive and coagulative, right? So this happens in case of tuberculosis, syphilis and leprosy, right? Syphilis, tuberculosis and leprosy. So it is a combination of both, and the gross appearance is cheese-like whitish color. It happens in spleen. Most commonly you can see caseous necrosis of spleen, sagospleen, lardospleen. There are various types of necrosis taking place in spleen, but caseous necrosis is seen in case of spleen. So we were done with caseous necrosis, which is a cheese-like necrosis. Now we'll study about fat necrosis. So this happens only in organ which deals with more of fat metabolism, right? So it can happen in the liver, it can happen in pancreas. So what happens is, see, in focal area of fat destruction resulting to release of active pancreatic lipase. So pancreatic lipase is an enzyme which works in the alkaline pH. It is released in the duodenum, right, wherein it digests the lipids into free fatty acids. The final digestion of lipid takes place over there. And what happens is, since it is poured into the duodenum, these are hydrolytic enzymes, right? These are very active enzymes, so they move towards the peritoneum. And they cause this type of fat necrosis. So example for this is in case of acute pancreatitis. What is pancreatitis? Itis means inflammation. Pancreatitis means inflammation of the pancreas. So enzyme leak from the acinar cells of the pancreas, right? We have our two functions of pancreas, which is exocrine as well as endocrine. So the exocrine part secretes the pancreatic lipase and various other enzymes. So what happens is, in the acinar cells they release the pancreatic lipase, which causes the corroding of the duodenum, and they enter the peritoneum. And what happens over here is, since pancreatic lipase can digest fat, so what I told you, that it will become into free fatty acid and it combines with calcium and gives a chalky appearance. A chalk-like appearance is seen, and this can be seen in case of pancreas. Yes, in pancreas it can be seen. Next is the fibroid necrosis. So this is a special form and seen only in case of immunological reaction, which is an antigen and antibody complex. So what happens here is the antigen and the antibody, they form a precipitate, PPT, or the precipitate, and deposit into the basal layer of the blood vessels, right? The basal layers of the blood vessel, and over the time, what will it cause? It will lead to a formation of an atherosclerotic plaque formation, right? A plaque will be formed. So this can be seen in case of malignant hypertension, and in case of kidney also it can lead to renal failures, right? So this is, with this we finished about necrosis, and let's study in detail about apoptosis, how it takes place and its type. So apoptosis, it is mostly physiological. Necrosis is always pathological, and it is accompanied by inflammation. But the major difference, in apoptosis it is mostly physiological, sometimes pathological, but there is no inflammation seen over here, right? There is no inflammation seen in case of apoptosis. So physiological cause during growth or change in hormonal cycles. So it is eliminated by lymphocytes and leukocytes. I'll give you an example. In case of menstruation, right? If the ova is not fertilized, so what will happen? The menstrual bleeding takes place. Why? Because of the hormonal changes. So it is because of apoptosis. There is no necrosis over there. There is apoptosis. And pathological to eliminate cells beyond repair. Example, radiation sickness, where cells are damaged. Accumulation of misfold proteins, right? There are certain misfold proteins like caspases. They are the misfold proteins. So if they accumulate in a cell, then the cell will die due to apoptosis, and it is pathological. So we'll study how apoptosis actually works. So we'll study the mechanism of it, right? So regulation by biochemical pathways that control balance of cell death and survival. So and these biochemical pathways, what they do is they activate a certain set of protein which is called as caspase, and they are cysteine derived. Cysteine is a protein, and they are cysteine derived. So it has two pathways. One of them is the mitochondrial pathway, and the second is the death receptor pathway. So mitochondrial is most common pathway taking place in pathological and physiological. So what is caspase? So what happens over here is caspase has many proteins. So it is a family of 20 proteins. Okay, there are 20 proteins in caspase family, and cytochrome C. Cytochrome C is an important factor to activate caspase. So what happens is membrane causes the leak of cytochrome. So when a cell has to die through apoptosis, what will it do? The cell membrane bursts, and cytochrome C starts to leak out from the cell, right? So what it does is it goes and it activates caspase. As I told you, it is a family of 20 proteins. They are proteins such as BCL2 and BCLXL. They control the permeability. So BCL2 and BCLXL, they control how much of cytochrome C has to flow out of the cell. And also they have another mechanism. They hold the pro-apoptotic membrane of family BAX and BAK. So what they do is BCL2 and BCLXL, these keep a check on BAX and BAK. So they don't allow them to enter the cell. If these two proteins have entered the cell, then yes, definitely the cell is going to die through apoptosis. So these are pro-apoptotic. That is, they always are in the favor of causing apoptosis. But BCL2 and BCLXL, they hold them in check, right? This is countering mechanism. So what they do is they keep it in check. But if the cell has to die, so cytochrome enters the cell, they activate this, then these are released, BAX and BAK are released. Cytochrome C activates caspase 9 specifically. In case of mitochondrial pathway, caspase 9 is activated by entering the cytosol, right, or the cytoplasmic membrane. So once cytochrome C enters, caspase 9 is activated. Then BCL2 and BCLXL, they promote the leaking of BAX and BAK, and then phagocytosis will take place. This is how the mitochondrial pathway works. Why mitochondrial? Because cytochrome C is present within the mitochondria, right? They're present within the mitochondria. That is why this is the mitochondrial pathway. Next is the death receptor pathway, which is also called as the extrinsic pathway. This uses tumor necrotic factor, TNF1 and FAS. So FAS is a set of proteins which is present in the cell membrane of T lymphocytes, specifically the cytotoxic T cells, CD95. So FAS is a ligand membrane. Okay, FAS is a ligand membrane protein. It is a ligand membrane protein on T cells, like I told you. When they recognize FAS expression, suppose when the T lymphocytes, okay, suppose the cell has to die via the death receptor pathway. This generally happens in case of tumors. That is why the T cells, the T killer cells, they are responsible for the elimination of tumors from the body, right? This is the pathway they use to eliminate tumors. This is mostly happening in case of tumors only. This is for normal process, right? This is normal process and is specific for tumor. That is why tumor necrotic factor is being used. So whenever a FAS expression is seen, FAS molecules start to cross-link, right? They start to cross-link by FASL. So FASL start to cross-link the FAS molecules and bind adapter proteins. They bind adapter proteins and activate caspase 8. So here it was caspase 9 in mitochondria. In death receptor it is caspase 8 and eliminate cell by cytotoxic C lymphocytes. So T lymphocytes. So cytotoxic T lymphocytes, they produce cytotoxin and hence they kill the tissue or the tumor, whatever is found. And next, how are they cleared? Suppose now we have killed the cells, now we have to clear it. So clearance happens due to production of eat me signal. So what is this eat me signal? In normal cells, what happens is this phosphatidylserine, right? Phosphatidylserine is present in the inner membrane. So if this is the cell, here is the presence of phosphatidylserine. But in an apoptotic cell, these are present up above them. So what happens is they cause the production of an eat me signal. So what happens? This attracts all the phagocytes to them, right? This attracts all the phagocytes and hence it is easier for the macrophages to go attach to them and engulf them. That is how phagocytosis takes place. Next is necroptosis, that is cell death by tumor necrotic factor. This induced by receptor interacting protein kinase. So in simple words, RIP, receptor interacting protein kinase, RIP is present over here. So again, tumor necrotic factor. So what happens here again is the T lymphocytes will come, but here it is not caspase 8, but it is RIP, receptor interacting protein kinase. So this is responsible for necroptosis, which is a mixture of necrosis and apoptosis. So after necroptosis, there is pyroptosis. This is associated with activation of systolic danger sensing protein complex, right, which is also called as inflammasomes. So what they do is they also activate caspase. This produces cytokines which causes an inflammatory response, and the cell dies again via the apoptosis mechanism itself, that is the death receptor mediated pathway, right? And here the interesting catch is fever manifestation is seen. This also causes fever, right, because of the release of certain cytokinins, right? Next is autophagy. Autophagy is what when a cell engulfs its own cells due to the activation of certain lysosomal enzymes, right, or the hydrolytic enzymes produced from the lysosomes. When does this happen? In case of nutrition deprivation of the cell. So what happens is the endoplasmic reticulum derived autophagy vacuoles initiates cytosolic protein, right? They initiate certain proteins which sense that a cell is having nutrition starvation. So what they do is they digest the cell in order to complete the lack of nutrition which the cells are having. So it can be seen in ischemic injuries, myopathies, and the polymorphism is an protein, okay, is a gene, sorry, which is involved in case of autophagy. With this, we have completed the chapter of pathology, which is cell death and injury. In next bit, we will discuss about healing and regeneration. And yeah, if you did learn something new, then do give a like, do subscribe, do share it, and with that, it's a wrap. Thank you for watching.